Yes, it's all about the winter look. Now, I'm here with Raj Aquila in the heart of Cheshire. You've got an absolutely gorgeous clinic, set away, very discreet. Everyone's always worried about when winter comes along, how do we feel sexy?
In winter, all we show is our face because we're wrapped up. But of course, everybody is beautiful. Everyone has got the ability to be more beautiful. And what we do is we tend to try and identify what people's strengths are. We try and correct any areas of weakness and give them a really good result. The process that we tend to use is by identifying the common causes of aging and trying to reverse them, or at least correct them. So, as we saw with Christine, our first patient, she had some Botox to generate a lower face lift. And what we're doing is we're trying to switch off certain muscles that are pulling the lower face down. And that encourages the muscles in the mid-face to lift the lower face and give a really positive result. So with Botox, we're looking at around 3 to 5 days before you start to notice results. By 1 to 2 weeks, you're going to get something that's definitive and it's going to last you, 3 to 6 months.
No pain at all, absolutely fine. As you can see, not a mark on me.
We can look at aspects of volume loss and trying to correct that with things like dermal fillers as well.
Great, and we saw that today as well, didn't we?
Yeah, absolutely. So with Jenny, our patient who had the whole face approach, and we used a number of different techniques using needles or cannulas to put volume back where it should be, where it has come from, and stop it migrating away from those sites. And again, that tends to produce a very positive effect and also a lifting effect.
She didn't look overdone, but it was amazing actually that she did have like a full facial rejuvenation.
Yeah, sure. It's really important for me and for my patients that we do things that are very subtle, very elegant, and also, quite sympathetic to their face.
I like the little thing you did with the chin.
Yeah,
thing. What was that?
Well, some patients obviously have a little division in the muscle in the chin, so it leads to a little kind of a little recession. So we just put a dot of product in there just to lift it up.
No, that is absolutely fantastic. I'm made up with that, really am. I can see a huge difference. The lines are completely gone from around there. I didn't think my chin could look like that. It's fantastic.
There was obviously one more patient that you did. Tell us what you did there.
Yeah, so Becky, she had a much more common procedure, which is upper face lifting, but in particular elevating her brow. She's obviously an incredibly beautiful woman. What we did was take one of her best features, which is a good strong brow, and lift it and reshape it. And it tends to feminize the face and enhance beauty.
Yeah, I'm happy with that. It didn't take long at all, and there was very little pain.
As we move towards the winter time, our skin changes. Conditions such as acne, psoriasis, eczema, which are very common, do improve during the summertime. And the reason is that the sunshine, the ultraviolet light, has an anti-inflammatory potential. Therefore, it keeps our skin clear from those inflammatory conditions. Now, during the winter, we spend less time in the sunshine and our skin is not as exposed. Therefore, those conditions will kick in. We should continue applying our sunscreen all year round and exfoliate. There are ways of applying exfoliation at home with scrubs and more sophisticated peeling agents with the dermatologist at their office.
Within your clinic, you offer impression-free dentistry. What's this all about? It sounds very interesting.
Okay, so if you ask a patient what are they worried about when they go to a dentist, the first thing they'll say often is, oh, it may hurt, or discomfort, or sometimes the numbing. But really, the next important thing they don't like is having molds taken off them, of their teeth. And that's this gooey stuff that they have in their mouth for about 5 to 6 minutes. And there are a lot of people who gag and salivate, and they really feel uncomfortable with this. So now we have the latest technology, which is actually a laser. It scans the entire mouth. So this scan then can be uploaded and sent over the internet to a laboratory in Europe, which then manufactures the models that we need to create the new teeth that they want.
Is that sort of the way of the future now with techniques like this?
Absolutely.
Yeah.
This technique is called CAD-CAM. It's been around for about probably more than a decade, but the future is going to be CAD-CAM dentistry. And over the next decade or so, I think impressions will start to move away from dentistry.
Hi, I'm Lou from the Cosmex Clinic in Cambridge, and I'm going to be doing a microneedling treatment using the genuine derma roller on acne scars on the upper back. The derma roller or microneedling is fantastic for rejuvenating the skin and improving elasticity of the skin or surrounding areas, particularly with acne scars. It will reduce the indentation of the scar and make them much more shallow. And we start with numbing the area, and then using a handheld roller, treating the area, which creates a mild medical trauma, which in turn stimulates the fibroblast cells and has a knock-on effect with the collagen. The skin will feel warm and look red or pink, which will subside quite quickly, 1 to 2 days back to normal. Treatments vary from area to procedure needed. With acne scarring, whether it's the face or the back, around about 5 treatments, with a top-up treatment the following year. With general rejuvenation and toning of the face, the neck, or the décolletage, usually 3 treatments and a top-up maintenance treatment the following year.